it's Kathleen Listen, and I want to talk a little bit about fibrosis and how, as a lymphatic massage therapist, I use different tools to treat fibrosis after liposuction, what fibrosis is, and my thought process on why I'm using the specific tools based on the specific type or presentation of fibrosis I see in the client. And this can change week to week as the client changes their habits or heals or wears a different faja or stops wearing their faja or starts wearing their faja. So a little bit about me. This is just going to be off the cuff. So I do teach Niktimba classes that give you CEUs for plastic surgery recovery massage, but this is just kind of me talking about one tiny piece of plastic surgery recovery massage, and that is the fibrosis piece. So if you want more details or you think this isn't detailed enough, it's definitely an invitation for you to go ahead and dive deep into one of those classes. So I have written the Plastic Surgery Recovery Handbook. I have a lot of tips in this book that I give to my clients on how to reduce fibrosis, and a lot of tips that they can do at home to reduce fibrosis. And also the Southern California Plastic Surgery Cookbook. This has a lot of information about what to eat before and after surgery, including some research on things that our clients may be able to eat, and the research states that it may affect their fibrosis. So when a client is eating some of the foods that I talk about that may affect fibrosis, they also need to have that lymphatic drainage at the same time as they're adding these things to their diet, because we can just break up the fibrosis and then it stays there. No, you need to move it out of the system. You can't just have that stuff like broken up and kind of staying static, kind of just stagnant in the area. So they need the mixture of lymphatic massage and the foods that can target fibrosis. So those are two resources. And then if you've seen my video, I go over what fibrosis actually feels like as you're with the client on the table. So I'll be talking about these two types of fibrosis, but I'm sure you've felt this in your clients. Either a putty type of fibrosis that feels like Play-Doh under the skin, or a more woody, firmer type of fibrosis. And this can be, we need to figure out which skin layer it's in and how the presentation changes, because there's not just one type of, feeling it, oh, there's only one woody fibrosis. No, for what I've seen in my clients, there's more than one type. So I try to see which specific type it is, and that will show me what type of cup I need to use for the lymphatic cupping, what works better and what works not so good. So over here I have my notes. So if I look over here, that's me making sure I get everything that I wanted to say in this video. So let's look at fibrosis, Fibrosis is when there's protein deposited in the edema. So after surgery, it starts with edema. And if that edema is not completely removed with lymphatic massage, it may start to slowly turn into fibrosis as the protein content increases in the interstitium. And fibrosis can happen everywhere in the body. It can happen to all different types of organs. Some diseases which have nothing to do with plastic surgery. One of the hallmarks is fibrosis. We've heard of liver fibrosis. We've heard of cystic fibrosis. But when we talk about fibrosis after liposuction, we're talking about in the surgical area, in the subcutaneous layer of the tissue, and maybe in the dermis. So that's what we're specifically talking about. And this kind of mimics what we see as certified lymphedema therapists with fibrosis that happens when there's lymphatic stasis after a client has a lymphedema diagnosis. So, but what I'm talking about today is purely, and all the things that I do are with clients that have an intact immune system. They do not have a lymphedema diagnosis. These are a little bit, some of the things that I do, I would really take pause before I did them on a client that had a lymphedema diagnosis. So this is definitely a video about fibrosis only after cosmetic liposuction for cosmetic plastic surgery reasons. So we'll start with the fibrosis has a spectrum, so it'll start putty, and then it'll, as the protein content increases, it'll get to a more woodier texture. And if you're not familiar with these, definitely look at my other video and buy them if you're so inclined to feel them with your hands. But I feel like you've probably felt this in your office with your clients. So putty swelling, I mostly see in the subcutaneous tissue, so underneath the dermis. So, and this can be really interesting because when the client stands, when the client is lying there, you don't see anything wrong right away. It's only when you feel and you get into the different layers that you're feeling, oh, there is something. It's not a normal subcutaneous layer. There's a little bit of putty type swelling in it. So I usually tell my clients, oh, you know, this is really good news. It's not really fibrosis, like woody fibrosis yet. It's more of just a swelling with a protein content. We can definitely use the lymphatic massage and other techniques to really get this out over the period of a couple weeks, and you'll look just fine. And I have a sneaking suspicion that many of the before and after pictures we see on some plastic surgeons' websites, the clients may have putty fibrosis, but because they stand and they look smaller than before surgery, it still looks like, you know, an amazing result. So I think putty fibrosis happens in more clients, and then just because you look good in pictures, people just looking at you may not know you're having this kind of difference in the subcutaneous layer. So woody, what happens, what are we looking at when we look at a more woody fibrosis? And that's just a more, see how this is like just a thicker type of goo underneath, and it's not so pliable anymore. So I can see more of a woody, more of a thickening, and then I can see that in subcutaneous layer. I can also see that it coming into the dermal layer when we start to see that peau d'orange, and that's my really bad French, but it looks like the skin itself, the pores will be large, it'll look like an orange skin. And clients will come, and especially when you try to move it around, you'll see like the large pores, the hair follicle pores, and it'll have that peau d'orange look to it. So I think it's coming, you know, there's like some kind of backflow where it can be just in the skin layer, or maybe just in the subcutaneous layer, or maybe both. So I treat that fibrosis different. I used to treat it all the same, and then some things would work for some clients and some things wouldn't work so well for other clients. And then I kind of got to the idea that these are related, but they're not exactly the same. So we can't have a one-size-fits-all treatment for fibrosis because we're having different presentations. And then, so that's just in a uniform, like in a large area of the operated area. We can also have lumps. And lumps aren't really all the same either. So I could have a lump that when you feel it under the skin, like this is the skin layer, and like this is a lump underneath, and you can feel through that dermal layer, you can feel, and it feels like putty. You can kind of like move it around, you see the edges on it, you can like push down on it. So that's some kind of lumps. And then I've also seen more of a lump where if you press on it, it feels like there's a marble underneath their skin. It really feels like, you know, just a ball of necrotic tissue. So even the lumps are different. And maybe that might be where people are saying lumps and then bumps. But these can be something that the client will stand in front of you and say, I have a lot of lumps. Do you feel any lumps? Because you can't see it. Their dermis looks fine. The outside skin doesn't look lumpy. The lumps are all in between in that subcutaneous layer. And then I've also seen a cording type of fibrosis where it looks like cording. So this is different from axillary web syndrome, which is what we learn as a certified lymphedema therapist that happens after when they take a lymph node out if they have some kind of a cancer surgery. Then you'll get something called axillary web syndrome where there'll be a strong cord and it will run here, and you can even see it in the elbow area. You can see it in the shoulder area. You can see it sticking out from where they took the lymph node out. this is the same feeling underneath the skin, where you're feeling underneath the skin and you can feel like there's a line. You can trace that line up and it feels like there's just a finger underneath the skin, and you can palpate that finger, and often it will end at or near where the cannula scar was. So I call it a cording type of fibrosis, and I want to help reduce that for the client. And I'm starting to think I'm postulating. The theory is it could be related to what we see a lot in the liposuction textbooks, that there is kind of a honeycomb. There's a honeycomb type of organization in all the different cannula strokes that go. They form this honeycomb, and then that's where, after the surgery, that's where your compression and your faja comes, because you are compressing down that area and moving the fat so it is more uniform after there's been a bunch of, infiltration with the cannula in all different types of directions. So maybe that is some artifact of the cannula going in and out in that area. And I would just like to gently break that down. So does that have blood clots in it? I'm not sure. I'm not sure what's in it. I'm not sure what's making it hard. These are just like my postulates, the different types of fibrosis that I've seen. So I can definitely have a client that has some of the cording, a little bit of the putty, and then sometimes this cording will be here, and it'll be up to the ribs and down. Often I'll find it here if they've taken a lot of fat out of the love handles. I'll feel these lines, these very hard lines that feel like, a tiny little finger, a twig inside the body. And then what I want to talk about is what we're doing, how we're making and affecting a change when we're doing the massage. So the first is what are we doing with the lymphatics massage? So I always will do lymphatic massage. And then what I do is actually the initial, that abdomen sequence that we do with the hand positioning. As I'm doing the hand positions, I am feeling what is the give of the tissue. Can I move the tissue in all 360 degrees in each segment of the abdomen? Does this tissue move all the way around? Does this? Where are there restrictions in the tissue? And if there's a restriction, is that a part of, are they getting this fibrosis? Is it affecting the dermis in that there's some kind of restriction? And then often they'll tell me, they feel like taffy. It's like pulling taffy to wake up. Often there's a lot of restrictions here, and that might be in the superficial fascia. It might be in the subcutaneous layer because of the surgery. Often the myofascial work will work well. So I'll start and end all the sessions with manual lymphatic drainage, and then in the middle, this is where I'm talking about other techniques. So this is some flour I had my husband loves me. He's from India. So we go to the Indian store, the Indian grocery store, and one time I spent about 5 minutes touching each of the different flours. And this flour really feels to me like some fibrosis at the 3-week mark. And you can see, I can get my hand in there, and then there's a little bit of pushback here. So this is like more than putty fibrosis is going. It's a very deep putty fibrosis. And then you can see, maybe if you use your imagination, you can see how this would be a pitting edema if you used cups. So that's another thing that you can use as on your soap notes, is when you're using the cups and you put the cup on this. And if I put the cup on this and I suctioned and I suctioned and I suctioned, and it was suction and release, and I left it there for like 5-6 times of suction, and then I moved it, is there like a little indent circle there? Is there a little indent circle? And when if I see a little indent circle, if I can make several indent circles in that tissue, that to me says it's pitting edema. There's a little bit of protein content in there. And then that is something that I would use in my soap notes, that this is a fibrosis and it has a pitting edema to it. So when I do my deeper techniques, I want to move all this stuff around, because my idea is this is different from regular skin, not only because there's swelling in here, but because we have this protein content. We need to start moving it around like we would do as a lymphedema therapist, do some deeper techniques on the fibrosis, and then the lymphatic drainage can start moving it out. That compression over time can help to keep it moved out. So we want to move some of this protein content around if we're having skin that's kind of indenting like this. And the myofascial, you can see how the myofascial work would work as well on this type of skin. So what do we do as far as our tools? So what kind of tools do I have? I have the Russian cups. So this is, you can see this is my smallest diameter cup. This is a more medium diameter cup. This is a very wide diameter cup. So when I'm lifting tissue in here, I'm not just lifting the skin layer. I'm not just lifting the dermis. I'm lifting the subcutaneous layer. I'm getting a lot of skin in here. And it's actually hard with this curvature. It's hard to not get a lot of skin. You can't just get a little bit of skin in here. So if I had someone who had that peau d'orange and I wanted to just affect that immediate skin layer, I would use a smaller cup, because I can get just the skin in here. I can definitely push this and get a really light level of pressure on here, the compression, the negative compression on here, and just get some skin only. And if I had liquid, if I had lotion, I could just get only the skin and rub. So it was very light. The client maybe even couldn't feel it, because we were on a regular client with regular skin, because we were just moving the skin around. We weren't really grabbing that subcutaneous layer, that fascia. So that's one of the interesting things that I do, is I really look at the diameter of the cup and how much I'm getting in. And I used to, first of all, I used to always use this, try to turn it up as much as possible, and because I thought more was better. But now that I've kind of understood, you have to look at which layer you want to affect. Do you want to just affect the dermis? Do you want to affect the subcutaneous layer? And all these are it's not an exact science, but this is what's going through my mind. And also with the IASTM tool, how are we using it? How are we, what are we focusing on? What is going to be best for that type of fibrosis? And I've usually seen, I will not use this if it's just an edema. It has to get into more of a fibrosis that I can really move around with this before I'll use the IASTM. So that is some of my ideas currently on fibrosis, and how I use the concept of different types of fibrosis to guide how I treat the client. And then I will ideally want to see, we'll get from an edema. Are we going to get here? Hopefully we won't get here. If we get here, we can definitely, with using some tools, we can pause, we can stop this in its tracks and then let it go down so it doesn't actually get to the fibrosis. But I have seen clients, they will come right in depending on their operation, and they will have a lot of fibrosis in that dermal layer, and then you have to use more of the dot foams and more of the deeper techniques to really move that around, especially if it's that peau d'orange. But I have had a really good result of someone who did have this type of fibrosis and extra compression. So I gave him a rectangle of the gray foam, and then I did these cups on him, and I really, moved it around and made sure that it was feeling where there was a stopping of the skin artificially, and using this negative massage to move that skin around, so everything kind of loosened up, and then with the compression and his compression garment, he was able to get a really good improvement in his symptoms in just that one massage. Okay, have a good day.